Welcome to Adapt and Class, video number 2 on our pharmacology series. We're talking about psych medication. Based on the test plan, I've taken 20 medication. I'm going to use 16 questions to analyze them. And this is the video you want to watch a day before you take your exams. If you're in nursing school and you're struggling, or you're preparing to take the NCLEX and you have issues with psych medication, this is what you need. 20 medication, 16 questions. Let's get it done. This is the first question. Which prescribed medication is most likely responsible for this finding? Read the question from the back. A nurse is caring for a client with what? Schizophrenia. That should tell you this patient is it will be on antipsychotic. Who, what? Stating something about what? My heart feels like it's skipping a beat. What do you think? Skipping a beat is the buzzword. So I have skipping of the beat with the schizophrenia, and there's a medication they're taking. What medication they're taking? Clozapine, Haloperidol, Buspirone, Zaprasidone. Key way to remember psych medication. Look at the last name. You can see number 3 and number 4 sound like the same. Therefore, they are antipsychotic. Clozapine is also an antipsychotic. Haloperidol is also an antipsychotic, first generation. But the question is asking you, skipping heartbeat. That means something is affecting your heart. Based on that, what do you think? Pause the video, put down your answer in the comment, then look at the way I'm going to approach it. There's only one medication that can affect your heart based on antipsychotic function. And that medication is what? Something that will cause you to skip your heartbeat. And that medication is what? It's not Clozapine, it's not Haloperidol, it's not Risperidone. This is Zaprasidone. All the antipsychotic have specific side effects. I have other videos you can watch. This one is designed to give you all the things you need. Zaprasidone causes QT prolongation. That is why this patient had a skipping. So which medication we should pick? Number 4. Next question. I designed the test in such a way that I give you other one, then I come down, then I go up, down, up, and down to test your knowledge. This is one of them. This, by the way I said it, it can be difficult. Which findings support this diagnosis? Select or apply. That means there's a diagnosis I need to worry about. And then it's assessing the client who recently started what? Sertraline, and is suspected of what? Developing Serotonin syndrome. Buzzword, how do you answer the question? Go with the buzzword. I say sertraline. I know what it is. You have to know what. This is the class of what? Depression medication, SSRI, right? Serotonin receptor inhibitors, right? And this is receptor uptake inhibitors. This is what they do. They increase your serotonin. You should not combine them with any medication that will add extra serotonin into your system. If you have serotonin syndrome, easy way to understand it. What do you think? Should you have muscle rigidity, hypotension, areflexia, calm, bradycardia, diarrhea, and hypotension? The way I do it is serotonin syndrome. When I see it, I would say everything is going up. If everything is going up, what do you think? Muscle rigidity, I'm going up. Hypotension, I'm not going up. Areflexia, I'm not going up. If I'm calm, I'm not going up. Bradycardia, I'm going down. Diarrhea, what do you think? Hypotension, what do you think? Based on that concept, what do you think? There's only a few answers there. This is new generation NCLEX. Select all that apply. Select all that apply is what you know. Muscle rigidity sound like it's going what? Up. I'm not picking. I would think about it and say, hey, muscle rigidity, I should be going up. That means number 1 is right. Hypotension, I'm going down. I'm not picking you. Areflexia, I'm going down. Calm, I'm going down. Bradycardia, I'm going down. Diarrhea, I'm going up. Constipation, you're going down. And hypotension, I'm going down. Therefore, the right answer is number 1 and number 6, right? Muscle rigidity and diarrhea are signs of serotonin syndrome. And those are the right answer. Number 3, what is the nurse's best action? She needs to do something. right? Best action, that means all the answer choice may be right, but it's one thing if she has to do, it will be the best one. The client is prescribed what? Sertraline, reports difficulty sleeping and a decreased appetite during their follow-up. Buzzword, patient is prescribed sertraline and they have difficulty sleeping and decreased appetite. What is the nurse should do? Reassess the client, reassure the client that the side effect will resolve in a time, instruct the client to stop the medication for a few days, notify the healthcare provider to change the medication, assess the client's mood and safety. What do you think? 10 seconds I'm giving you to answer this question, or stop the video and answer it, or put your answer down in the comment. What do you think? I'm prescribing you sertraline. You came back for a follow-up and you have difficulty sleeping and decreased appetite. What is the most important? And when they give you a question on antidepressant and the patient is following up, the number one thing you should worry about, especially SSRI, when they started the first 2 weeks, suicidal ideation is number one. Therefore, patient safety and their mood is the most important. Reassuring the client about the side effect is not good because they just started the medication. 2 weeks is important. Instructing the client to stop the medication is not good. They cannot just stop it. Notify the healthcare provider to change the medication. It will not change it. The most important thing is to assess the patient. How do you assess the patient? Check their mood and their safety. That's key. Which finding require immediate intervention? And this is caring for a client taking what? Clozapine for schizophrenia. Which medication is it? This is what? Antipsychotic. What kind of antipsychotic? Second generation. So I'm trying to give you the content regarding that medication so that because this class of medication is antipsychotic. Every time you see it, think about that. Which of these should you worry about? Patients complain about constipation, weight gain, you have fever and sore throat and drowsiness. What do you think? Put down your answer in the comment section. But the key concept to answer this question is what? Clozapine causes agranulocytosis. Write it down. It causes agranulocytosis. Once again, write it down. Agranulocytosis. That means it causes leukopenia. And therefore, if you have any signs of infection, it's a problem. Constipation is suspected finding. Weight gain is suspected finding. Drowsiness is expected finding. But when you have fever and sore throat, I'm being sharp. And that's prioritization 101. That should be the right answer. Number 5. A nurse is caring for a client on what? Haloperidol, who developed what? Tremors and stiffness. Those are the buzzwords. I'm going to circle that medication, haloperidol. And what did the patient develop? Tremors and stiffness. What do I need to answer the question? I need to know what is haloperidol. It's a first-generation antipsychotic. Do they cause what? Tremor and stiffness? Of course, yes. Is it a bad problem? Yes, it's a bad problem. That's what we call Neuroleptic Malignant Syndrome. Which medication should the nurse anticipate administering? What is the treatment of this problem? NMS, how do you treat it? Or the side effect of haloperidol, the major one, what medication do you use? Propranolol, lorazepam, tropine, cyproheptadine. How do you treat this medication or this condition? What do you think? The problem is you have to calm them down. But calming them down is not enough. You got to attack the muscle. So the best medication to treat it is not propranolol or lorazepam. I'm not going to choose them because they will take away the anxiety from the patient, which is good in NMS. You got to calm them down. But the actual medication that can counteract the haloperidol is benztropine, which is going to help with the muscle rigidity. Cyproheptadine is used for serotonin syndrome. So the right answer is number 3. And has completed a staff education session on Bupropion, another medication you're supposed to know. And this is why I put it there. This is a common board favorite. You see in nursing school, you see in NCLEX exams, this is great to know. Bupropion is what? Is atypical antidepressant. And I told you there's a word there, sustained release is coming. Which client situation required the nurse to intervene? Select or apply. A client with the history of bulimia nervosa, a client with the diagnosed seizure disorder, a client who smokes 1 pack of cigarette per day, a client crushed the tablet before administration, a client reporting dry mouth and mild insomnia. What do you think? It's a select or apply. You don't have to pick everything. Pick the one you're 100% confident. I always say 101, 110, 120% for the next generation NCLEX. You have to pick something that you're confident about. This is pharmacology, practice test on psych medication that usually shows up, psych drugs. So which one will you pick? First, you got to look at the medication. Like you said, stop the video, answer it, then progress and listen to the way I approach it, right? So that we can all work it together. I know you're keeping a score. We are number 6. Bupropion is atypical. There's a word associated with it, sustain. So it comes as a extended release. There's certain things you should know about this medication. It causes appetite suppression. So you should not give it to anorexic patient who does not want to eat. So number 1, we got to intervene. If you have seizure disorder, it decreases your seizure threshold, so you have more seizures. You should not take bupropion. That's number 2 things you have to know. Number 3 is used to treat what? Tobacco. It helps with tobacco cessation. So when the patient smoke 1 pack per day, it's a good thing. We don't need to intervene. It comes as a sustained release, as the question says. You should not crash it. The patient crash it. Number 4, need intervention. Number 5, a client reporting dry mouth and mild insomnia, expected finding. Who need intervention? Number 1, bulimia, seizure disorder, and 3, crashing the tablet. That's the key thing you need to know about bupropion. And this question answers everything about it. A nurse is providing teaching to a client prescribed what? Lithium for bipolar disorder. Another medication that is good to know, right? It's an anti-epileptic and it's used for what? Mostly for mood disorder, especially bipolar disorder. And that is what we use it for. That's lithium. If you don't know anything about bipolar, remember lithium. Which statement the nurse should intervene? That means bad stuff they're saying or they're doing. If you provide teaching about lithium, I will increase my sodium intake, number 1. Number 2, I will take acetaminophen for knee pain. I will need routine lab draw. I will notify my healthcare provider with nausea or anorexia. Number 5, I will drink 2 to 3 liters of water a day. 5 answers, select or apply, pick those that you're 100% confident. If you know it, pick it. If you don't, if you are 85%, don't pick it. 99%, don't pick it. I want you to pick it when you have 101, 110%. What do you think? Stop the video, put down your comment, think about it, jot it down. We're doing a quiz, pharmacology quiz, quick and dirty way of answering pharmacology. Lithium, what do you know about it? I can tell you it's a trap. Number 1, you should not increase your sodium or you should not decrease your sodium. You should keep your sodium constant in a normal range. Therefore, number one, need intervention. The patient said, I will increase my sodium intake. I will take acetaminophen for knee pain. Why is the patient saying that? Because NSAIDs can affect your kidney. If it affects your kidney, lithium love a kidney that is diseased. Lithium love a kidney that is diseased. That's the easy way to think about it. Anything that affects your kidney, lithium say happy birthday. Therefore, lithium will hate a patient that taking acetaminophen. They want you to take NSAID so that you can destroy your kidney. So number 2 does not need further teaching. I will need routine lab work. Very toxic, so we got to check your drug level. I will notify healthcare provider with nausea and anorexia. Why? Because number one signs and symptoms is GI symptoms. I've said it multiple times. The easy way to know a drug toxicity is GI side effect. Most of the bad medications we have, which have narrow therapeutic index, they start with GI, like digoxin, especially lithium. So you should notify the healthcare provider with nausea and anorexia. Why would you drink 2 to 3 liters of water a day? Because you don't want your kidney to get in trouble, and lithium make you dehydrated. Therefore, hydrate yourself to fight lithium. So which of these options we should intervene? Number one, we should intervene. 2, you should not. 3, you should not. 4, you should not. 5, you should not. So there's one thing that patient is saying that it will increase his sodium. But taking acetaminophen is good. I will need a lab draw is good. I will notify my healthcare provider with signs of toxicity is good. And I'll drink a lot of water is good. What is the next immediate action? The client is receiving haloperidol. You've seen it again. It's febrile, confused, and has muscle rigidity. This is the same question, but I'm testing something different. You will see this in the NCLEX. See the same thing repeated multiple times, but there's something in the question that's changing the concept. Every question has a concept. This question concept is different. If the patient is receiving the same medication we saw, haloperidol, but yes, febrile, is confused, muscle rigidity. What would the next do? Immediate action, prioritization. Would you give the patient benztropine? Would you check their vitals? Or do you hold the medication and notify the healthcare provider or apply cold compression? Think about it. You have everything you need in this patient. He's febrile, that's vital signs. He's confused, that's vital signs. He has muscle rigidity, that's also physical exams to make assessment. Why would we check your vitals again? What is it going to tell you? Benztropine is going to treat it, but this is a dangerous problem. You need help. So the best help you need is by notifying the doctor and holding the next dose, because you cannot give him his haloperidol again. So every time you see this kind of question in the NCLEX, remember, holding the next dose means don't give any further medication. It doesn't mean the medication is scheduled 10 hours from now. It's a good answer choice. So 3 is the best answer. And next is reviewing dietary instruction with the client. Prescribe what? Phenoxine for depression. Another medication you're supposed to know. Phenoxine is what? It's the MAOIs. They are very dangerous. Their major problem is hypertension. There's certain things you're supposed to know. Avoid medication that will make your blood pressure goes up. Avoid diet that will make your blood pressure goes up, because you should avoid tyramine-rich food. Which food should the client avoid? Every time they give you MAOI, this is a board favorite. They're going to ask you about dietary, because that's what is going to kill the patient. How many more answers have you had? 8, 9? How many have you got right? I hope you get this one right. Number 1, grilled chicken. Should the patient avoid that? Fava beans, should they avoid that? White rice, should they avoid that? Ricotta, should they avoid that? Cream cheese, should they avoid that? Fresh mozzarella, should they avoid that? Think about it. These is things that the board will put in your exams. The nursing school will put in your exams. Pay attention, nursing students, nurses. And this answer choice is a good thing for you to know. When I give you a question, there's a keyword, which is the concept I'm testing. The things they're supposed to avoid is what? Tyramine-rich food. So anything that is smoked, right? Anything that is aged and fermented. 3 things, that's all. Fermented, aged, and smoke is a bad thing. Grill is fine. Fava beans is bad. That's a lot of tyramine food. White rice is good. Ricotta is a cheese, but it's not fermented or aged. Cream cheese is not fermented or aged. Fresh mozzarella is not fermented or aged. So those cheeses, they can take it. Therefore, there's only one answer. If you pick more than one, you get 0, sorry. So number 2 is the only thing the patient should avoid. One answer. A nurse is providing district teaching to a client prescribed lithium, same medication we've seen it for bipolar. Which instruction is most important? You see, it look like the same thing that we saw in the selected apply, but I'm trying to give you variety of options so that you can be familiar with. Lithium, we talk about it. Make your kidney happy, make your sodium normal, and hydrate yourself. Those are the three things. Kidney happy, sodium normal, hydrate yourself. Patient said, and then she instruct the patient to avoid salty food. That's a bad thing. The patient should limit fluid intake. That's a bad thing. Report hand tremor. Of course, it's okay. It's bad, right? But think about it. Maintaining adequate hydration is the most important than reporting hand tremor. You want them to prevent their hand tremor. Therefore, you should teach them to what? Hydrate themselves, maintain normal sodium, and avoid hurting the kidney. So 4 is the right answer. 3 is not. NS is providing district teaching to a client. Prescribe what? It's no Bupropion. This is called Buspirone. It's also, it look like Bupropion. Bupropion is antidepressant, atypical. Buspirone is an anxiolytic, anti-anxiety medication, but what is used for? Anxiety-related and is atypical. Which statement by the client indicate the need for further teaching? Things you need to know about Buspirone. My anxiety will improve within a week. Is it true? I will take the medication in the evening to avoid sedation. Does it cause sedation? I will avoid consuming grapefruit juice while taking the medication. Should you avoid grapefruit juice? I will take this medication with and without food. Do you need food or no food? The medication are low risks of dependence. One of the good things about Buspirone, this is the content, compared to benzos, it has no sedation, it has no dependence. Therefore, number 5 and number 2 is what? Think about it, it's a trap. The medication at low risk of dependence is good. That's number 5. So there's no need further teaching. But number 2, I will take the medication in the evening to avoid sedation. Well, it does not cause sedation, so you can take it anytime. So 2 need further teaching. My anxiety will improve within a week. It's not benzos. It takes 3 to 4 weeks to work. Therefore, between 2 to 4 weeks. Therefore, that needs further teaching. I will avoid consuming grapefruit juice while taking the medication. The medication, it can affect your liver because of, and then grapefruit juice increases the toxicity. I can take this medication without food. You don't need to take it with food. Therefore, 4 is good. So what are our answers? My anxiety is not going to improve in a week. That's the wrong answer. We got to intervene. I will take the medication in the evening to avoid sedation. There's no sedation. We have to intervene. 1 and 2 have to intervene. 3 is fine. Avoid grapefruit juice. 4, I will take this medication without food. It's good. You don't need to take it with food. So that's fine. And 5 is okay, low risk. Therefore, 1 and 2 are your right answer. That's everything you need to know about Bupropion. This is a key. You see 3 questions of Clozapine. Why? Because it's a key thing. There's a different way they can ask you. So I try to tackle every area. And next is assessing the client 1 week of what? Therapy on Clozapine for psychosis. Which finding is most concerning? What is one thing about Clozapine you should worry about? We saw one, I give you a fever, but this one, there's no fever there. There's drooling, there's diarrhea, there's a weight gain of 2 pounds and temperature of 98. Put down your answer. I really want everybody who watch this video to put down their answer to number 12. I want to see what was the answer before I give the answer away, because this is always a trap. So stop the video, put down your comment, tell me what you think number 12. I'll reply you. So what is the answer choice? Drooling sound bad, right? But the drooling here is not airway, it's salivation. It causes hypersalivation, so they cannot hold their saliva. So this is common with Clozapine. Diarrhea, no, it's not good. Diarrhea is not good. Why? Because it causes agranulocytosis. And when you're having diarrhea, it's a sign of it may be sepsis, infection. 2 pound weight gain is suspected finding, and temperature is normal. Therefore, number 2 is the right answer. And next is caring for a client who has recently started on what? Amitriptyline for depression. This is what we call TCA, Tricyclic what? Antidepressant. They are my favorite. And I call them the dance. DANCE, the dance. If you taking amitriptyline, watch for the dance. The D is dermatitis. The A is anticholinergic. The N is neurological problem. The C is cardiac toxicity. And the E, you have to evaluate. Therefore, anybody on amitriptyline, look for the dance. Therefore, based on that, which one should you prioritize? The A, the anticholinergic, is the dry mouth and constipation. The blurred vision is anticholinergic. Drowsiness and dizziness, or it may be also related to anticholinergic. Heart skipping, a beat, and confusion. That's neurological and cardiac. Based on that, what should be your answer? I know you picked number 4, and I know you watch Adapting Class. A school nurse is monitoring a child who has been taking methamphetamine for attention deficit hyperactive disorder. Know this medication, know this medication, know this medication. Even if they change the name, they give you derivative, and they tell you it's for ADHD. The signs and symptoms never change. The answers never change. All of them are stimulant. Therefore, they speed things up. But what they do, they deal with something that I'm asking you. Which findings should the nurse report to the care provider? Sedation and hypertension. Should you report it? Daytime fatigue and drowsiness. Should you report it? Decreased appetite and 30% height and weight chart. And the blurred vision and headache. What is the concept here? What is the concept? Once again, stop the video, put down your answer in the comment. But what do you think these medications, they are stimulant. Therefore, everything is supposed to go up except few things. Therefore, if I see hypertension, I say it's expected finding, right? If I see headache, it's expected finding. They don't cause sedation because they are stimulant, right? They don't cause drowsiness and fatigue. It's unrelated, right? But what they do, there's 2 things. They make your weight go down, and your height and weight go down, and they decrease your appetite. This is the key. So every time you see a kid on methamphetamine, the priority is decreased appetite and what? Height and weight reduction. And that's your priority. So number 3 is the right answer. Number 15. This is the class of medications to put you in a perspective. It's an anti-epileptic, Valproic acid. There's a bunch of them, but this one has specific side effect. You have phenotide. Valproic acid is also another group of medication that you're supposed to know. So this is anti-epileptic. And nurse is providing teaching to a client prescribe what? Valproic for bipolar. They can be used for bipolar. I call them anti-epileptic. Which instructions should the nurse include? All these anti-epileptic, they have very common side effects. They are sulfur drug, and they are teratogenic. Those are common to them, all of them. So, and you have to monitor therapeutic index. 3 things you have to know: sulfur drug and teratogenic. But for valproic acid, it has its own specific side effect, and that's what I'm testing. Select apply. Patient said what? Report any unusual bleeding and bruising. Is he associated with Valproic? Minimize alcohol to 1 to 2 beers a day. Take the medication on an empty stomach. Take an acetaminophen if you experience stomach pain. Routine lab draw may be needed. Take your oral birth control medication daily. What do you think? Once again, select or apply. You don't have to pick everything. Pick those that you're confident. And then when you pick it, make sure you're 100% sure before you move forward. If you are not 100% sure, you let go. Valproic acid, this is the content. Specific side effect. It causes thrombocytopenia, so it affects your platelet. It affects the liver, that's the second one. And it causes pancreatitis. 3 things you're supposed to know to answer questions related to that. Apart from that, it's a teratogenic and it's a sulfur drug based on the fact that it's anti-epileptic. Teratogenic means it causes neurotube defect. So this question is answering everything. Report any unusual bruising and bleeding means it causes what? Thrombocytopenia, and therefore you're going to bleed, and therefore we got to pick that one. Minimize alcohol 1 to 2 beer. Well, it affects your liver. Why do you want to minimize alcohol? I don't want you to take any alcohol, zero alcohol. Take the medication on empty stomach. It causes GI upset and pancreatitis. You should take it with food. Take acetaminophen if you experience stomach ache. If you have stomach ache, it may be pancreatitis. 2, the acetaminophen will affect your liver. So we have a problem. I need a routine lab draw, maybe needed. Yeah, that's good. Take your oral birth control medication daily. Well, it's a teratogenic. They make oral birth control ineffective. You should have a barrier reliable method. You can still take the pills, but somebody have to wear a barrier method. That is condom or female or male condom. Therefore, which instruction should the nurse include? Reporting any unusual bruising and bleeding is good. That's good answer. 2, we should not include it. 3, take the medication on empty stomach. We should not include it. 4, take acetaminophen if you have abdominal pain. We should not include it. 5, you need a routine lab draw. Good. And taking your oral birth control daily, no, we should not. So there's only 2 answers there. If you pick more than 2, you get 0. And the last one, I save it for the best. If you reach here, I want you to stop the video, put down all your answers, and let me know. This is prioritization of antipsychotic, antidepressant, psych, drug, medication, pharmacology for nursing school, nursing student, those practicing, going to take the NCLEX. But this is the key. What do you think? And nurse is assessing several clients. Which finding is concerning? Select or apply. We talk about some of this medication. Some of them you not see them. You're just seeing them right now. A client is taking trazodone, report dizziness when standing up. A client taking isocarbazide, report muscle twitching. A client taking ziprasidone, report chest fluttering. A client taking paroxetine, report decreased libido. A client taking lorazepam as positive pregnancy test. A client taking risperidone is unstable to sit still. A client taking selegiline had what? Cottage cheese last night. What do you think? Content right here I'm going to give you. And each medication I'm going to tell you the most important. Trazodone causes priapism, but it also causes, that's the priority. It causes orthostatic hypotension. This is why the patient have dizziness when standing. That's expected. Don't pick it. Isocarbazide is MAOIs. It causes a little bit of dizziness, confusion, muscle twitching. That's not a priority. Those are common side effects. The major side effect is hypertensive agency. So it's muscle twitching, it's not serotonin syndrome, or it's not NMS. They don't cause that. They can cause serotonin syndrome if you combine with any serotonin product. The client taking ziprasidone, which is antipsychotic, reporting what? Chest fluttering. We saw it as in the question. This causes QT prolongation, which you intervene. The client taking paroxetine, that's SSRI, report decreased libido. That's expected finding for all antidepressants, especially SSRI. A client taking lorazepam is a benzos, right? They increase, you have dependence, and then you can have withdrawal symptoms. They're different from Buspirone, which are what? Anxiolytic, but they're atypical without sedation and dependence. The biggest thing about lorazepam, you should not take it when you're pregnant. So we should intervene for that one. A client taking risperidone, this is antipsychotic. That's the major antipsychotic that we use for second generation because it's weight gain. But the major side effect is unable to sit still. This is akathisia. We should intervene. A client taking selegiline had what? Cottage cheese last night. It's a MOI, but cottage cheese is allowed because it's not fermented or aged. Therefore, which patient condition is concerning? Number 3, ziprasidone, lorazepam, risperidone. Those are the one is concerning. 16 questions, 20 medications, psych drug of our series. Thank you for watching. If you like this video, thank you for watching, and put a comment down for the channel to grow. Take care of yourself, and bye.